Wow, it has been a long time since we've done one of these, friends, but we are back with another Health Writing Wednesday, and we are going to jump right into the conversation today. I am excited to dive into this one, and I have a feeling that a lot of you are going to be able to relate to what we are going to be discussing today. So let's cut right to the chase. Also, if you are new here, I'm Megan. I'm a public health pharmacist by training, but my career has been spent mostly in communications and writing in the healthcare space. I'm also the founder of Health Professionals to Health Writers, which encourages and helps healthcare providers learn how to replace a portion of their income and leverage their clinical expertise as freelance health content writers. If you are new to this channel, you are going to see me looking off to the side. That's because I have the whole outline with notes so I don't miss any of the important concepts that I want to talk to you all about today. So if you see me looking off to the side, that is exactly why. But thanks so much for being here. One of the reasons that I get so excited and enthusiastic about working with pharmacists and other healthcare providers is because in our profession on the clinical side, on the direct patient care side, even sometimes in the indirect patient care side, I find that many of us lack the fulfillment in real life that we expected to experience and feel when we were going through school or going through our training experiences, preparing to work as healthcare providers. Many of us came into the field because we were interested in helping to positively impact patients' lives, helping to educate patients and their families, helping to make sure that basically people were able to get the care they need and the information they need to live healthy lives. Unfortunately, as many of us can probably attest to, when you enter the real world and you are in your actual work settings, whether that be a community setting, an ambulatory setting, a hospital setting, or other type of inpatient setting, we know that in a lot of cases, the experience that we expected to have as healthcare providers is not the real experience that we actually get. And that is for a multitude of reasons. A lot of times it has nothing to do with the patients. It has everything to do with the politics, with the corporate players, with the stakeholders who are not the patients that you're taking care of, with working conditions, et cetera, et cetera. The list goes on and on. And so, unfortunately, because of that disconnect between expectation and desire and reality, there can be a lack of fulfillment in your professional space. You can feel like you did all of this work, spent all of this time, blood, sweat, and tears to accomplish this goal of becoming a healthcare provider for very noble reasons. But you can also feel like there's something missing from the actual provision of that care because of all of these other factors that are involved in the experience that you're exposed to at work. And so in this video, we're going to talk about one specific way to amplify your voice and your impact on your patient population or patients in general as a pharmacist or other type of healthcare provider. And I've already shared a little bit with you about my background. You all know that I come from a medical writing and health communication space. So you can assume that the way that we're going to be talking about amplifying your voice is through medical writing and communications. And so I want to provide that caveat up front so that you know where we're going in this conversation. If you're someone who has been interested in medical writing or some type of healthcare related communications over time, this is going to be a helpful conversation for you to better understand how that space could help not even necessarily take the place of your healthcare career, but maybe even just augment it in a way or give you a lane within healthcare that allows you to get some more of that fulfillment that you might be missing or not experiencing to the degree you would prefer to experience in your full-time career. And so understanding that you might have to look outside of your 9 to 5 or your 7 to 7 or your 12 to 12, like whatever your schedule is, you might have to look outside of that full-time career to get some of that fulfillment you're looking for, because as we know, we only have a certain amount of control over the actual environment that we're working in. And so thinking about ways that you can supplement or complement what you're already doing and getting that fulfillment in that space might be a productive way for you to figure out how to adjust your professional career to be better suited to what you're looking to do. So, a few points that I want to make sure we cover before I dive into the specific benefits of, or the specific ways of amplifying your voice through writing and communications. First and foremost, your value does not lie in your workplace. I have talked about this in recent posts on LinkedIn about how we associate our identity, how we define our personal identity. Some people consider their profession or their status as a healthcare provider to be a part of their personal and individual identity. Some people look at it as just a job, right? It might be a job that I'm passionate about, that I'm excited about, that I appreciate, but at the end of the day, it's still a job. And whether or not you consider your job to be a part of your identity, it's something that you want to make sure that you're not placing all of your value and all of your worth in, because a job is transient. That can change at the drop of a hat. Many of us have experienced that over the past 1 to 2 years, as the job market has become a little bit more unstable. And so thinking about your job as your pure identity or as your pure source of value might not serve you in those times when your job is not as secure as you would like or not as fulfilling as you would like. Understand that you've acquired the knowledge and the skills and the expertise that you need to be a valued healthcare provider, and that value is sticky, it's portable, it goes with you wherever you go. So if you transition from an inpatient job to an outpatient job, right, you still have that intrinsic value that you possess. If you transition from an inpatient or outpatient direct patient care role to something that has nothing to do with direct patient care, you still have that intrinsic value because of your knowledge, your skills, and your experience. So I want you to understand that your value is internal, it's intrinsic, it goes with you. It is not in a title or in a specific role. The second thing I want to clarify up front is that just because many workplaces may feel like they don't prioritize or center patient education in the way that they should, to be honest, does not mean that patient education is not still a huge priority from a public health perspective. It absolutely is. As we know, we can be the best coaches for our patients. We can give them all the right medicines, all the right treatment plans. We can give them the best facilities and the most serene environment to get their care. But if we're not communicating to patients how they can better take care of their own health, how they can prioritize their own wellness, we are not giving them the tools that they need to be well outside of medical facilities, to flourish in their own spaces and through life. And so patient education, health literacy, all of those things are incredibly important. And unfortunately, within healthcare systems, we often don't have as much time as we would like to share that education, to do those activities that would help improve and promote a person's individual health literacy. But again, there are opportunities outside of the traditional healthcare system to do so and to lean in more closely to patient education, which is really important. And the last point I'll make before we talk in more detail about amplifying your voice as a pharmacist or healthcare provider through writing and communications is that it's not too late to do something new. Whether you are a recent graduate, you've just finished your rotations, you're a resident, you are a fellow, you are an attending, you are about to retire, wherever you are in your trajectory, you are not in a position where it is too late for you to start something new, to transition, to shift. It might be uncomfortable and it might be a little bit scary depending on how far along you are in your journey, because the longer you stay in one space, the more used to and secure you feel in that environment. And so if you have to shift to another one, it's a valid thought and experience that there may be some discomfort there. But experiencing discomfort doesn't mean it's impossible. Being afraid doesn't mean it's impossible. And so I want you to know that making those shifts and making those transitions is not something that's out of reach for you. It's something that requires work. It's something that requires time and effort, but it's not out of reach. Okay, with those three disclaimers already shared, I want to dive a little bit deeper into the meat of this particular conversation. Now, again, I've already shared with you that this is going to be focused on medical writing and communications. You might have expected that, knowing that I am a writer and communicator. And you might have guessed that in my humble opinion, I believe that writing and communications is an excellent avenue for pharmacists and other types of healthcare providers to be able to flex their patient education muscles. We do it all the time verbally, right? You're maybe not as much as you would like because of, again, all of the other factors we talked about, but there are plenty of opportunities in direct patient care experiences where we're able to verbally communicate to patients the information that they need to know. It might be counseling them on a new medication. It might be letting them know what to expect for, an exam that they're about to have, or a treatment plan that the physician is considering. A lot of ways that we communicate information to patients. But there are also many ways that we can do a better job of communicating information in a written fashion. And to me, the beauty of communicating information in a written fashion is that we are able to better access patients even when they're not within the confines of a medical facility. So when a patient is at a doctor's office, at a pharmacy, seeing a nurse, we have them in a particular space. We know what they're there for, and we're able to very easily communicate with them face-to-face or verbally to share information. But we know when those patients leave that space, they don't just go off into the sunset and always do what we say. They might go to Google and look up a phrase you said to them that they didn't fully understand so that they could get more information about it. They might text a friend who works in healthcare to see whether they've heard about XYZ or their thoughts on it. They might text a family member. They might go to ChatGPT and see what it says. They're looking for information from other sources because they want to validate what you said. They want to find out more information. Maybe we didn't have enough time to go in depth with them and we missed something that we should have told them. And so they're going to try to fill in those gaps on their own. And in a lot of ways, they are filling in those gaps with written information. So it's not enough for healthcare providers to be trained on simply communicating verbally to a patient. There's also a place for us to be trained on how to communicate with the public and with patients in particular in a written way. And we don't get that type of training in our academic programs. Typically, we don't get that type of training in, residencies and fellowships. If anything, we get experience with manuscript writing, with publications, with poster presentations. Those are all clinician-facing, HCP-facing methods of communication. What I am referencing that is especially important when it comes to patient impact and patient education are patient-facing communications. So that might be the types of blogs that a person is going to Google and searching for, and those blogs are coming up to answer questions for them. It might be handouts that they're finding online or that their healthcare providers are giving them to take home and to review. It might be infographics that they see, on a subway or in a bathroom stall. All these different forms of communication that they're seeing outside of the medical or healthcare environments, but that are also communicating very important information to them. So one issue is that there's a lack of communications, written communications and writing training within our programs. That doesn't mean that you can't still get that experience outside of your academic programs. It's just acknowledging the fact that we don't get that, and that written communications is different from, it's similar to and also different from verbal communication. So there are lots of aspects of communicating directly with patients in a written way that are really important to learn if that is an area of interest for you. I have a playlist on the Health Writing for Health Professionals YouTube channel where you might be watching this. Hi, YouTube family, if that's where you're coming from. There's a playlist on the channel that's called 8 Different Types of Medical and Health Writing. If you have not watched that playlist, I would encourage you to go to it after you watch this video. The premise is that when we talk about medical writing, oftentimes we just throw out the term without specifying what type of medical writing we're talking about. In reality, medical writing is an umbrella term, and there are lots of different types of medical writing and health writing that fall within that umbrella. Some of them are more provider-facing types of writing and communication. Publications is one example that we just spoke about. And then there's also the types of writing and communications that are geared towards patients and consumers. And health content writing, which is my personal specialty area, that's what I teach through Health Professionals to Health Writers. Health content writing is, in my, again, humble opinion, one of the best types of health writing, one of the best types of medical writing there is, and the most effective when it comes to patient impact and patient education. So if you are someone whose interest in medical writing primarily revolves around the opportunity to educate patients and consumers, health content writing is one type that you really want to look into and learn more about. A great example of health content writing is when you go to Google and you type in a question. Maybe it's some type of medical question you have, like how can I take Tylenol and ibuprofen at the same time, right? So let's say someone has that question and they go to Google, they type it in. The results that show up in Google are oftentimes going to be blog articles that a particular company has written and published to help answer this question or solve this problem that someone has. So health content writing is creating written materials that help to answer a health question or solve a health problem someone might have. And because millions and millions of people use Google to ask health questions, they are able to find lots of examples of health content writing through that particular search engine. It's very accessible to patients. Anyone who has a phone, a computer can easily go to Google and look for the information that they're trying to get. And because of that accessibility, being a health content writer and creating the type of content that shows up through those search engines is a great way to have a broad and widespread impact on patient education, helping people get accurate information, because we all know that there's a lot of inaccurate information or misinformation out there, helping the general public get accurate information about the health questions that they have. So as you learn more about medical writing, if you, again, are particularly interested in how you can better educate patients, if that is something that's important to you in your career or your professional trajectory, I would encourage you to focus in on health content writing and learning more about whether that would be of interest to you. And then again, I would encourage you to watch this video on how to get started in medical writing when you don't have experience. The reason that I would suggest that video is because it gives you great ideas of, for beginners, again, someone with no experience, ways that you can start to get practice and to kind of flex these skills on your own. Like understanding that you might not be a writer, you might not have written in a long time. The only type of writing you might have done may have been that manuscript writing or publication writing. But if you're interested in learning more about health content writing, then you want to start to get in some reps in communicating to patient and consumer audiences. And so that video on my page, How to Get Started in Medical Writing with No Experience, is going to give you some ideas of how you can start to get some practice in writing for patients and writing for consumers. When I began health content writing, it was really by accident. I was in a position that was more focused on regulatory writing, which is kind of more on the medical writing side. Like the audience was not a patient or a consumer. The audience was the FDA and other regulatory agencies. And while I learned a lot in that role, I found it a little drier than I would like to have experienced. And so I started a blog on the side because I just wanted something that was going to give me a little bit more of the fulfillment and the interest level that I had. And so I started this blog that was for like my family and friends, just answering common questions they would ask me about pharmacy. And I realized that that was the type of writing that I would want to do professionally. But because I started writing on my own just for fun, I was able to get in a lot of practice and a lot of reps. And by the time that I realized this is a monetizable skill, I had already gotten in a lot of practice. And so I was in a place where I was able to um, with integrity charge for those skills, right? Because I had practice and I had developed those skills over time. So think about ways that you can start to practice and develop those skills over time as well. Everyone starts somewhere. So even if right now it feels like, well, I don't know what to do, I don't know where to start, think about questions. And now I'm starting to tell you what's in the video. Some suggestions are to like think about questions that patients or friends or family members might ask you about your particular specialty area. So if you're a pharmacist, if you're a nurse, an occupational therapist, what are questions that people ask you all the time that you usually answer verbally, or maybe, maybe even in a written way if it's via text message or something. But start to practice, like, how would I write this out in a written way? And see how that feels. And if it's something that interests you, then you might be, that might let you know that you might be interested in pursuing something like health content writing in the future, and then you can learn more about that. But hopefully these suggestions are helpful to you and you kind of understand how health content writing and patient education go hand in hand. If you are ever interested in considering or joining future cohorts of health professionals to health writers, you can always comment waitlist under these videos and I can share more information about the program with you from there. Otherwise, I will see you on our next